Okay. Good morning, everybody. It's our weekly Care Manager informational webinar. This is Megan O'Connor, and we have a pretty heavy agenda, so we're going to get started. Okay, so this is week 7. Hard to believe. I know time is just really flying by, and we have updates that we're going to provide on things that are relevant and priorities for this week. We also have a message from Jim Moran, our CEO. We are also going to have, Charlie is going to cover mileage reimbursement, and we have Ben Cat who will be talking about billing. We're going to have human resource updates, and Dr. Byron will be doing a talk about some other priorities, including the IM assessment and life plans. We're going to update on training, and then we're going to have everybody's favorite new add to our webinar, shout out. So I am going to quickly turn this over to Jim.
Great. So good morning, everybody. Happy Thursday. As Megan said, we're week 7. We're doing this in weeks. We're not counting the days anymore. We've stopped doing the day count thing since we're going up to go live. But anyways, week 7. So we continue to make a lot of progress. The staff are doing a great job. We've now aligned we have a care manager aligned with every individual enrolled with Care Design, which has been no easy task, I must say. Each of you and the supervisors and regional directors have done a great job, helping us get to a place where everybody is assigned now, each individual now has a care manager. So thank you for making that happen. With this, though, has come, as we were working through this and all of the work that Ann and I and others had done in sort of leading up to go live, one of our major commitments have been around the issue of caseload size and supervisors. Unfortunately, we have not yet lived up to that expectation of what we have told people, and that's because of our challenges with the workforce. So we know that a number of you have taken on additional people, and we really appreciate you doing that. Supervisors have also taken on individuals to support, which again goes against our goals of what we're trying to do. So we are committed to reducing the caseloads where appropriate to do so. And we also want to make sure that the supervisors, we wean them off of caseloads because that's really should not be the job of a supervisor. And we want to make sure that, in fact, we get to a better place with that. So that's going to come in time. We will not be there overnight, but it is important. We recognize that this is not something that is going to result in necessarily the highest quality support for individuals and families that we want to see, which is what we're all about. So we will work hard with you to get this to a better place. The good news is we have hired 51 new care managers since July 1st, and we have 21 offer letters being finalized as we speak. The problem is we still have a ways to go, but we are getting there, and the HR update will sort of fill you in on more details related to that. So thank you. So the other thing we're going to do is we want to really get a message out to folks. We're not obligated to send out a welcome letter to all the existing folks who sort of transitioned over from MSC to care management. The state did not require us to do that. It's only required for new individuals that came to us starting after post-July 1st. And so we're working on that. But in the meantime, we did want to try to get a message out to folks through the care managers, via email or face-to-face or some other means that really tries to at least welcome, in a certain way, welcome everybody and really speak to what we're doing and trying to make sure we're meeting people's expectations around support. And we also wanted to introduce the topic around individuals and families having the opportunity to become part of our family advisory boards that we're going to be setting up in the regions, which is number one, is a requirement of the Health Home program, but we've expanded it to be far more intense in terms of the number of boards that we're going to have and the participation of individuals and families in everything we do. So we do want to start to get that message out as we go forward. So that's my update.
Oh, and here's the message.
And the message is here, so you can see it. I'm not going to read it. You can read it, and this will be coming out, right, we'll be shipping this out later today or whenever, Megan will be getting this out to folks. Okay? So thank you.
Thanks, Jim. Okay, we're going to turn this over to Charlie, who is going to give us an update on expense and mileage reimbursement reports.
Yes.
Go ahead, Charlie.
Sure. Good morning, everyone. My name is Charlie Krajacek. I'm the Vice President of Finance, and happy Thursday as well to everyone. I did want to share some good news and some other news regarding the expense and mileage reimbursement reports. The mileage reimbursements will be paid this week for those care managers paid by ACH. That's the good news. We're actually going to do a file upload later today to our bank. And the only caveat is the ACH transfer should happen next day, so you should be receiving your funds. Again, that's for those who have ACH payments. You should receive the funds tomorrow.
Charlie, it's Ann. Sorry to interrupt. I just want to say for the non-fiscal people, ACH means direct deposit into your bank account.
Yeah, it's ACH. It stands for Automated Clearinghouse, and that's the bank's nomenclature. That's their terminology for direct deposit. Yeah, that's correct, Ann. And those who are being paid by check will receive their reimbursement next week. But just to finish my thought for ACH, on rare occasions it will take 2 days. So some folks may get their funds Monday, but most of you will get your funds on Friday. And what is the period of time that represents? Because many of our care managers have submitted more than one report. So we have accumulated from inception all expenses submitted through August 10th, which is last Friday. So we did our best to batch them all together and, accumulate a payment for each care manager. Going forward, that payment will be on a biweekly cycle. So what our intention is now that we're caught up is to pay those folks again via ACH payment or direct deposit. You will, on the week of payroll, you will get a payroll ACH, and then the following week you will get your mileage reimbursement. But for those who are receiving checks, you will get a check the same week that you get your payroll. So that's the frequency that we are setting up. So it'll be pretty much bi-weekly in sync with payroll. So there is an exception, though. If you have not provided your driver's license information to HR, then technically you're not eligible to be driving for work and you cannot be reimbursed. Therefore, we have pulled those folks out and you will not be getting your mileage reimbursement at this time. So what we have done is we have actually provided ourselves a list. It's called the LENS program exclusion list. If your name is on that list, you are being temporarily held for mileage reimbursement. So you will not receive a payment. But it's an easy fix. All you need to do is provide a copy of your driver's license to Human Resources, and your name will be removed from the exclusion list, and your funds will be released not only for this current reimbursement, but going forward as well. So hopefully that's a lot of information I threw at you, but hopefully, the good news is the money is coming this week, but if your name is on the LENS program exclusion list, please provide your driver's license to Human Resources so that you can get your money as soon as possible. Okay? And before I turn over the billing statistics to Venkat Apana, our billing manager, I did want to just share a little information about the source of those statistics. It's our Care Manager Progress Report. and I think Jim briefly went over it last week, but I wanted to go over it briefly today. The Care Manager Progress Report is something we do every week, and it's after billing. And what we're doing is we capture by every specific care manager and supervisors that are managing a caseload. And what we're doing is we're recording the number of cases that have been assigned to you. So if you've been assigned, say, 40 cases to manage, we're tracking that. We know that number. And then we track the number of claims or cases that you bill each week. So in week 1, if you bill 10 claims or members, we'll track that. And and if you had 40 members or 40 cases assigned to you, you would have 10 cases billed versus 40. And 10 over 40, I think we all can do, that's 1/4 or 25%. And that we're calling that, and you're going to hear this again, that's the realization percentage. And we also call this care manager, us in billing, the realization report. Because what is being realized? What are we billing compared to the cases that have been assigned? So in week 2, if you bill another 10 cases or members, then it will accumulate. So week 1 you have 10, week 2 you have 10. So now you're up to 20 cases billed versus 40 assigned. So 20 divided by 40, your realization percentage is 50% in that case. So those percentages are important to understand. That's where, and we're coincidentally at the middle of August, more or less. We're pretty much at the middle, and Venkat has now taken those percentages and he's done a pivot table, and he will talk to you about his results, not only of where we landed in July, but where we stand so far in August. So without any further ado, I'm going to turn this over to Venkat.
Thank you, Charlie. Great explanation of the statistic that I presented here in the slide. For July, we decided to remove all of the HCBS member and the non-Medicaid folks, and that kind of like increased our bill percentage by a tiny amount, actually 1%. But the main thing here on this slide for July is the amount of people not billed. I mean, everything was going right. We should have billed, most of these. I know there were a few hundred folks that we couldn't bill because of checklist issues. But as it stands right now, for July data service, we haven't billed over 3,000 people. We could still bill them as long as all the requirements are met, and the service was provided in July. So I will keep you guys posted for the July numbers again. For August, the numbers.
Venkat, excuse me, before you move on, the other really more important factor around that slide that Venkat was discussing, the issue is more so we've got 3,500 people that appeared not to have any contact in the month of July. That's a more important issue than the fact we didn't bill for them. Because our commitment was that we were going to touch everybody during the month of July. And this would tell me that that did not happen. Because if it did happen, you'd have had a billable service. So that means we have more than 14% of our population we did not have a direct contact with. That is not good. And we need to make sure that that doesn't happen in the next month. So if in fact you've made the contact and it's not fully complete, we still have time to go back to July. But the point is those contacts have to be made. We have to be touching everybody who we've taken over. This is 7th week now, and everybody should have had a touch by now. And so I'm very concerned, not so much about we didn't bill for the person, but the fact that this would tell me we did not touch 3,500 people who are getting health home care management services. So that's a real problem that we really need to make sure it doesn't get repeated in August. Those 3,500 people, if they were not touched in July, have to be touched in August. We cannot go 2 months without communicating with people directly, not where you write them something. It has to be a two-way conversation here. So that's the important part of this, not so much that we didn't bill, but the fact that since we didn't bill, that means you didn't have the right contact with people. So that's a quality issue, more so than a billing issue, quite honestly.
And we know, from being out in the field, this is Ann, I've heard, we've heard loud and clear the challenges with Metasched. But Jim's right. I continue to get emails and phone calls from family on a regular basis that they do not know who their care manager is, or they have not been contacted. And then I know there's a very small percentage of you out there where it will be documented in the Metasched record that you have tried and tried phone calls, outreach, and now you're doing certified mail return receipt requested because you cannot reach families. We do understand there's a very small percentage, and thank you for your efforts on that. And we are at the point now, if you have not made contact, we need to start doing those certified letters so that we can continue to demonstrate all of your efforts in trying to connect with people.
Okay, back to you, Venkat.
On to August. As Charlie mentioned, we're halfway done with the month, and based on this, the numbers I'm showing right now, billing was only about 30% of our total membership. I hope we catch up, but we don't want to be in a situation that we have for July again. So ideally, we should at least have about 50%, I would say. But, like I said, there's still time to catch up. But, we have to take care of the July, at least in my opinion, before we start working in August. But, the slide pretty much tells you the story of what's going on. For example, we have 114 care managers that haven't done anything. The next band of range, 1 to 24%, 240 people that only, percentage-wise, that's how much, the work they did. So I hope you guys, catch up. We still have time, and, I hope that August will be better than July. Anyone have any questions?
Well, it's hard for them to have questions, then. I'm sorry, they're muted, but we will get them at the end if you want to stay on, and if we can get to questions today. And if not, what we'll do is we divide out the questions and conquer, so any fiscal questions we'll forward to you.
Okay. Yeah, and thank you, Ann. And this is Charlie. I just want to underscore what Ben said. If you look at those bands, those percentages, what I mentioned earlier, those are the realization percentages. So the 0 band means, to what Ben said, he's spot on, that there was no billings for 114 care managers. The next band means that the realization percentage, and granted, we're only halfway through the month, that means in that band, those 240 care managers either billed somewhere between 1% or 24% of their caseload, which, considering we're halfway through the month, that's a low number. So that's what those.
Okay, so we're going to move forward with the agenda, and we have Lisa Rees here, who is going to provide us with human resource updates on recruiting and hiring to start with.
All right. Well, good morning, everyone. So we're very excited. We have a lot of activity in the area of recruiting, and as you may know, Steve Morgenstern, our Assistant Vice President of Human Resources, and Suzanne Brown, who is our Human Resources Manager, have been diligently working along with Alex Kwong in the New York City office on the area of recruiting. They've been very busy, as you could see from the earlier slides that Megan showed, as far as all of the people that we have hired since July 1st and all of the people that are in the hopper for job offers. There are several more who have been sent to regional care manager directors for interviews and so forth. So we're really working hard to try to get these positions filled. We're advertising through Indeed. We advertise in Career Builder. We've been attending job fairs. And of course, we have the employee referrals, which, you know, we've been getting employee referrals. And certainly since we announced the employee referral bonus, the activity has even increased more. And we encourage you to continue to seek out people that you know in this field who you think would make wonderful care managers with us. Please send us those names, ask them to apply, ask them to send their resume to us. They can send it, actually right now they can send it directly to Suzanne at sbrown1@caredesignny.org if they want to send their resume to her. So we encourage that activity. We are holding a job fair, I think it's at the, not next week, but the following week in Brooklyn. So we are getting a lot of activity at these job fairs. So we're very optimistic about.
So we need to get that job fair information out so we can put it out to our workforce.
Sure. Okay, we will absolutely do that. Okay, well, I'm going to kind of jump order here because the referral bonus update is really part and parcel of the recruiting activities, and I just want to clarify a little something. I know that when you refer an employee to us or refer an applicant to us, you certainly have a vested interest in a couple of different ways for what happens with that candidate. You know, are we considering them? Where are they in the pipeline, and so forth. But just please, I want everyone to understand that when you refer someone to us, our communication around that candidate's consideration is with the candidate. We will not be providing our existing employees who may have made the referral any kind of an update to say, yes, we're considering them, no, we're not considering them. It's really not appropriate. We want to maintain that level of confidentiality in the consideration of an applicant directly with the applicant. So if you have a friend that you've referred or someone in the community that you've referred and you're curious about their status, you can ask them. But please don't ask us because we are not going to be providing you with any kind of an update. I know it's difficult, but I hope you understand that you would expect the same courtesy if you were in the position of the applicant. Okay. So going back now to the I-9 documentation, we have some difficulties with this. So Holly has been diligently working for the last 7 weeks on trying to round up all the I-9 documentation. We have too many employees who have not responded to her request for documentation. We have a series of people who have just not responded. They haven't provided any documentation. They haven't done their Paycom onboarding, and we will be reaching out. Holly has been in communication with all of those folks. If any of you are on the call, you check your inbox. You'll have an email from Holly. It's very, very important that this documentation be provided to us by the end of the day tomorrow. We cannot continue to run the risk of having someone employed with us who has not met the I-9 documentation requirements, and it's unfortunate that we would have to go to the point of suspension of employment, but that is ultimately what will happen should the documentation not be provided by the end of the day tomorrow.
And that means that your access to Paycom and Metasced and Litmos will all be suspended. So you will not be able to log into anything at CareDesign, nor will you be compensated for any time because you shouldn't be spending any time because you're suspended.
Right. So,
and hopefully we won't have anyone, because everyone's going to be in compliance, because this is a ridiculous thing to have to get to, that you can't provide information on your ability to collect a paycheck.
Right. So, you know, for those of you on this call today that are wondering if you're in this category, if you have not heard from Holly, you don't have anything to worry about.
By the end of this morning, still have a few more people to send out.
All right. So Holly has a few more people to send out. So if by noon today you have not heard from Holly, you're good to go. Okay.
Okay, thanks, Lisa.
Well, if you're still on updates, I just wanted to mention two little things. The LENS program, the providing your license to HR and making sure you're cleared so that you can get paid for your mileage reimbursement. Please do not email HR and ask if you're in good standing. We will be sending out a list, or we'll be sending out targeted emails today to those of you who have submitted mileage and have not provided your license information to HR. So we cannot be bombarded with 50 or 100 emails asking if you've been cleared and you've provided your information. So hold tight, you will get an email if you're not going to be getting reimbursement. Thank you.
Well, and to that point, let me just also add, if you have not provided your driver's license information to Holly and you want to do so, you don't need to send a copy of the license. You just need to email her with your driver's license number. Pull it out of your wallet, send her the email with your driver's license number. We can get that information entered into the DMV system and get finance updated with that information, so it won't hold up any expense reimbursements that you may have submitted or any in the future.
Okay, thanks.
Thank you. Okay, our next topic is some healthcare updates, and I'm going to turn it over to Dr. Byron.
Hi, Paul Byron. Nice to hear from everybody. I just want to give you guys a quick background on who I am, just for a reference point. So I went to chiropractic college, osteopathic school, medical school, trained at a residency at Albany Med and family practice. Probably the biggest aspect of my background is that I've been the medical director and clinical director at the local facility, the Capital District DDSO, for 20 years. And with that kind of background, I mean, I think I'm in a good position to help care managers with some of the, the health-related issues that we're going to come up against, and maybe even some of the regulations that we face related to healthcare. We started this discussion last week. We talked about consent and end-of-life planning and referred everybody to the Choices booklet. But I'd also like to just let you know that I've had some questions related to some difficult cases, sometimes to treatment questions, sometimes to medication usage. Eventually, we'll get into the management of chronic and acute disease, sometimes developing relationships with specialty docs and specialty dentists. And also, if someone just needs a second opinion on one of the cases that they're working on, I'm available for all of those things. Paperwork, which usually for me is a signature. I do doctor signatures for ICF level of care, for disability statements. Some of the legal paperwork that requires an OPWDD credentialed doctor, such as on healthcare proxies. It's the 300 series of surrogate decision making, not the 200 series, but surrogate decision making. There's some paperwork and some places where I could sign as the consulting doc on surrogate decision making paperwork. At times, you probably, hopefully, won't deal too much with death packets and investigations, but I'm involved with those discussions also for medical opinions. And so pretty much anything related to medicine, I'm available to do those things. Reminding everybody that we're still technologically challenged here in the first floor of our building at Corporate Woods. Cell phones don't work too much. But I'm available on my personal cell phone. The number's there, and then I'm available, and that's if you need an immediate answer. And then I'm available by email, certainly. And I'm working part-time, 4 to 5 days a week. So I'm generally available every day for anybody, who needs to get a hold of me. Through training, we're going to start working on, chronic disease and presentations on medical illness and things. Nancy Shea and the group, some training. We're going to work on developing some webinars and some handouts and things. There's lots of information out there, obviously, and we'd also like to hear from you about what topics you're interested in, and so we can start to imagine how we would set up the training programs. Once we get done with the initial new employee training, then we're going to start to do some of those medically related topics. Thanks.
Thanks, Dr. Byron. We're going to continue on our agenda. So I wanted to give a quick update to people. There's been a lot of questions around what are we doing as it relates to caseload management with individuals who are on Tier 4. And this is certainly, a hot topic for us and the other CCOs as well. And we have been, Jim's been in discussion with OPWDD in terms of the impact of these requirements. And we are waiting to kind of hear back from them on that. In the meantime, We will be providing, in very short order, some guidance and updates out to our management team and to our care management staff. We really want to make sure that we're doing this as thoughtfully as possible. We realize that the caseload transitions that will have to occur to meet the Tier 4 compliance will result in some, some change and transitions from individuals and families that really may want to be with their care manager. So we really see this as a significant issue, one that we will be getting more direction out to you all very quickly, and really trying to do the best we can with this and do it in a way that hopefully creates as minimal disruption as possible. Jim, I don't know if you have anything to add to that?
Yeah, no, we know this is an important issue on many fronts. The other issue that we've now started to see also cropping into this is now we have our second month of enrollment information, roster information, and we see people changing tiers. So we've had, in the month of August, the enrollment roster had, for Tier 4, had 55 changes of Tier 4. That's both into Tier 4 and out of Tier 4. And that's a challenge, particularly people moving across the tier, like on a monthly basis. How do we manage people changing tiers constantly, potentially, or other people changing? It's going to wreak havoc with the entirety of how we manage this and how that impacts other families. So just this morning, I elevated this conversation within OPWDD, not only around the Tier 4 general issue of how to get to a 1 to 20 and the timing of that, but also the fact that month by month we're having people going in and out of Tier 4, and how can anybody be expected to manage that in a reasonable way? So more to come on this. We know this is an important issue to everybody, and we'll continue to provide you updates as soon as we have more information on it.
Thanks, Jim. Okay, so Lori Liptak is going to give an update on the IM assessments, and we do have some new news, which we think is good news, as part of this update. So, Lori, I'll turn it over to you.
You have new news?
Well, the first bullet here.
Oh, okay. All right. So the CCOs have been working with the owner of the IM app and the company that developed it and the engineers, and we now believe that the IM Chromebook issue has been resolved. I actually have worked on it and tested it and wasn't able to break it, although there are still a few things that need to be worked out in the IM app, but it's working. But however, one caveat is it is sensitive to the Wi-Fi. So when we did training this week, we did it all on the iPhone hotspot and nobody had any issues. So that was great. There were 20 plus people in the room. We couldn't break it. It is not working on the surfaces right now, though. However, that should be fixed within the next week. You heard me mention training. We've completed what has been known as the gold standard training for the IM app, a series of the supervisory staff, including, and then in addition, the regional directors and some care management directors and the training staff have gone through line by line and learned the IM assessment. So we will be providing detailed instructions next week on how to go through the IM assessment. As much detail as we can give in the hour and a half that we have allotted. We'll be doing it twice next week, as always, on Tuesdays and Thursdays. We are going to advise you strongly to pull out the IM user guide from Litmus, print it out, and look at it. There are a lot of nuances to the IM app, even more nuances than I initially realized before we went through training, that you have to understand where the information is and how it gets collected. So we are going to encourage you to go through that guide and take a look at it. Even if you think you've done an IM assessment and you think you've done it correctly, please go back in and take a look at that. All sections of the IM the IM app will need to be completed, at least for the first go around. So there's no more picking and choosing of sections. And there's a mantra you're going to have to keep listening to, and that's 2 blue, 3 gray. You'll understand more what that means next week, but it's 2 palms goals, or it's 2 palms outcome, 3 goals. And we are required to achieve those to the IM assessment based on the CCO requirements through OPWDD what we committed to in our application to OPWDD and in our own policies and procedures. So there are things, it's more than just a series of questions. There are outcomes we have to achieve and capture, and we will do tons of training on this over the next couple of weeks. You can go in and practice with this in the sandbox, and I would encourage it. Do an assessment on your dog, on your kid, on your spouse, on your, somebody sitting across the hall from you, so you can see where everything is and get a feel for collecting all of the information.
Some of those could be very dangerous, Lori.
Well, the good thing in that danger is that I can't read the IM, so you can't come to me and ask me if you answered the questions correctly, because we can't get into it to see how you answered the questions. Those questions come over into the life plan, which is the next step. So we know as an organization, all CCOs across the state are behind on creating life plans for a variety of reasons. We have a priority focus for the next couple of weeks that we need to get through. Willowbrook class members, Tier 4, we knew that we had a 2-month extension in the last couple of days. Jim, did we hear any additional extensions for Tier 4?
No.
Okay, so right now, we need to start having those done in September. For the July-August ones need to be done in September, and we need to be on schedule moving forward with those. All remaining Tier 4 enrollees are the second group that we have to clearly focus on. Remember, all these folks have to be on a life plan by the end of the calendar year. And then the August new enrollees, which in a matter of just 2 weeks will become the September new enrollees. They all new enrollees have to have completed life plans within 60 days of being newly enrolled into our CCO. So now that Metasced is up and running, we really need to, and the IM assessment is working, we need to actively and aggressively start working towards those life plans. So the training plan is next week, we're going to do IM assessments. The following week, we're going to get more into the mechanics of what to do with that information as it comes over into Metasced. And then simultaneously to that, we're going to be taking a hard look at what a completed life plan looks like and what you've done, and you're going to be getting a lot of coaching. And that's, we're coaching ourselves as an organization and the technology as much as we're coaching you guys. It's an uphill learning curve on this. This is totally new, but I have complete and total confidence you guys can do this because you've been writing ISPs for years. Metasced, my favorite topic. I just want to take a minute to say to everybody that if you're having problems with your name not showing up, your notes are freezing, you can't save them, you've got tasks on your calendars that you can't delete, you can't change different things like that. It's not you, it's not a user issue, it is a Metasced issue. And we have sent them videos and pictures and talked to them repeatedly about the issue, and we've even offered some suggestions as to what the issue could be that they should be looking at. We know that these are issues. You don't have to email me on these top three. Please don't take it personally. It's not you. Log off, log back in, and I swore my entire career I would never give that advice, but here I am. So care managers, for the supervisors, please know that the care managers, if you kick back their notes, they cannot change the task. We've made a request that they should be able to change them to the appropriate task, but they can't. It's a Metasced issue. So if they logged that they were feeding the dog and they were actually feeding the cat, I'm sorry, they can't change it right yet. We'll let you know when they can. So just know if they kick it back, they can't change it. And also, finally, you heard Venkat talk a lot about the care coordination progress reports, and I know you guys are emailing me, and they're not completely accurate, and it has a lot to do with that whole in-person task being met and reported. I talked to Metasced on Monday. They're still aware of it. They're still looking into it. So we do know that people may have completed all 40 tasks for an individual, but it might show on that report that they only did 8 successfully. So we know about that, and that's why Ben and Charlie's team are so awesome, because they can then take and match that against the actual claims to see where there's any discrepancies. All right.
Okay, thanks, Lori. Nancy Shea is going to provide some training updates quickly. Go ahead, Nancy.
And she's not a panel, and she can't present.
Okay, I'm not sure.
So poor Nancy probably can't speak, so we'll pinch hit. Who's gonna pinch hit?
Okay.
All right, Lori and I are
Lori
playing
is-
musical
Lori
seats,
is
so.
coming back on here.
Hang on.
So, Nancy, if you're listening, I haven't completely read your slide, I skimmed it. So basically, Nancy has a message to you that training is an incredibly important aspect of being a care manager, and we have to abide by a 208-page training guide that the state put out for us, which the information in that guide is actually fantastic. It's really, really good information. But we've been providing tons of training, we'll continue to provide tons of training, but we need a way to capture that and quantify that. So the training team right now is working on a way to allow you to capture and quantify your own personal training records so that we can then, you will then turn it into a regional specialist, and it'll be uploaded into either Litmus or some other system that we have still working through to decide how we can actually be able to monitor how much training that's provided. In addition to that, don't forget, you've got 3 courses in Litmus that are due at the end of the month. Oh, I gotta do new employee orientation too?
You do, yes. Yes, I get to do new employee orientation.
No, yes, I'm sorry, I'm sorry. I said it that way because I haven't skimmed the slide, so I'm doing this really completely cold. So, the training group has been working on a 3-day new employee orientation that's gonna begin next week. This is going to be our first run at it, so we're actually really excited. You can see on there the locations and the dates and times. We're going to ask the care managers should be receiving that have been selected to go through, receive an email asking them to register in Litmus. Unfortunately, we can't put everybody through it, but we're going to get a lot of new folks through it. So is that quick enough?
Yep.
All right. Email encryption training?
Yep.
Me too? All right. So we're rocking and rolling right here. Okay, so there is a new email encryption training that is in Litmus, and we did not include this actually in our HIPAA training and the security policy training. So we're asking everybody, in addition to those 3 courses, to go into number 4, go into email encryption, read the document there, and then sign the attestation. Going forward, anytime we do the security policy retraining or HIPAA retraining, it'll be added into there so you don't have to repeat it. All right, we just want to welcome all of our regional training specialists. You can see in the slide, we got Colleen in New York City, Rocco's up in the North Country, and we've got Natasha, Kenya, and Scott starting soon, and if you guys know of anybody great out in Brooklyn or Staten Island that would be interested in flying, send them our way.
Okay, thanks, Lori. Okay, we're going to start doing shout-outs really quickly. We have a number to get through. Thank you to folks who have sent them on. I'll just start here. So first shout-out is to the Flushing team and Cheryl Lee for 100% checklist and billing for the month of July. To Billy Patras and his team for the role they played in ensuring all individuals are covered with care managers and going the extra mile to access records. To Seth Clark, who's a new care manager who has already handled some very challenging matters and has truly gone above and beyond to meet the needs. Seth assisted a family with a 5-year-old in making dozens of calls to access 4 weeks of round-the-clock respite while a parent recovered from surgery. Thank you, everyone. Ann.
Okay. So thank you for going the extra mile to provide other care managers with IT assistance. That's just a general shout out to everyone. Danny Smith has been a godsend with assisting others with OneDrive Chromebooks, expert technology skills, and helping the Southwoods office. Yes, even if you're out in remote areas, we even at our main office still need help. So this is from Patty and Ann. Nathan.
And Hyam.
Thank you. I told Lisa she's on standby to help me with pronunciations. Okay. And it's for thank you for your technical support in setting up Chromebooks and troubleshooting from Gabby Gass. And Christina Schmidt put together a PowerPoint on Chromebooks and shared them at team meetings from Tricia Chapman. And Amanda, you're not paying attention.
Oh, I'm sorry. Well, Lori distracted me.
Amanda Saramini.
Sarami.
So, see, thank you. I butcher names. I have a standby. It's like phone a friend. And so Amanda, thank you for serving as an unofficial in-house IT staff, patiently assisting other people. From Patricia Gormley. Thank you.
Okay, Danielle.
Okay, this is to Victoria, Rosalind, Francisco, Jennifer, and Sonia at the Grand Concourse for volunteering to assist with case coverage. To care managers, supervisors, Gianna, Shantae, Stephanie, and Darlene, and to senior care manager supervisor Karen for assisting to complete checklists and billable activities for cases that needed coverage after 2 care managers had to leave suddenly. That's from Annabelle. And to Tamar Rod for providing technical support training while maintaining excellent support for individuals on her full caseload, from Rose.
Jim.
To Christina Bernhardt, who went above and beyond in supporting an individual to obtain a safe living environment to meet his needs. This included extensive travel, accompanying him on many visits and medical appointments to ensure his needs were met. She even went shopping on her spare time to ensure that he had some essentials for the move. After a pursuit that took a few years, he moved this week to a residence in Brooklyn. Great job. That's from Amel Mohammed Whiteside.
Okay, more shout outs to Melissa White and Andrew Danziger from everyone at the Brentwood site. Andrew, for your assistance and patience with helping to set up equipment in Metasked. You always put aside your work to jump in and help. Melissa, for your continued support through the transition. You were always someone we could go to with questions and when needing support. A huge thank you to both from the Brentwood team.
To the Pearl Street team for patience, understanding, workarounds, and with the transition office space challenges. Kudos to everyone there, Julie, Charlene, Amanda, Beth, Carol, and the new care manager supervisor.
Dahlia?
Okay. And to the Capital District directors, Lisa Miller and Renee Hebert and Tricia Chapman, for taking the initiative to foster collaboration between sites they support, including building relationships and resource sharing. From Carrie Wood.
Okay. I just have to make a little correction. Somebody brought a note into me, not to disparage Danny Smith. But it was actually Danny Richards, who is our little tech goddess here in at Southwood. But Danny Smith is also wonderful and keeps everyone's spirits up and has lovely pineapple lights in her cubicle.
There are 4 Danielles at Southwood alone. 5, I'm sorry.
So to Danny Richards, thank you, Danny.
Thank you. Okay. To Gerald Gadsden for going above and beyond for an individual who lives on his own through guardianship process, access to food stamps, and helping the individual formulate a schedule for how his income should be spent by the IFS provider. To Elizabeth Clerkin for her ongoing efforts to keep Staten Island in the loop and for her supervision of care managers at different locations. And to Lavidia Blaze for her assistance with Willowbrook class individuals while taking on additional responsibilities as a supervisor. From Natalie.
Okay, so we're at the end of the webinar and we're going to try to get to a few questions. I know that this has taken us pretty far along in our hour, so we are scrolling through questions here.
One of the things I wanted to mention too, it's Ann. I've had some questions, and many supervisors have had questions that people have wanted to maximize their commute time and listen to the webinar during the commute. And I really want to strongly discourage that. I don't think that's a good idea. I think if you're commuting, you should be focusing on driving, or if you're on the train, you're probably losing connections a lot. So we really want your full, undivided attention for the webinars. We talk about a lot of things. We go through them really quickly because there's a lot to pack in. So we do not want you calling in and listening to it on your way to different places. We really want you to carve out the time to pay attention and give your undivided attention to the webinars, or if you have a conflict, to then catch up and listen to them. They're all on Litmos, and their answers with the team. That's what they're under. So please do it that way instead of trying to pack in and multitask, because you will miss something, and we don't want that to happen.
Okay, here's the first question. When should we start IM assessments? Right now is the question. And yes, now that we've resolved the Chromebook technology issue or glitch, people can begin to do the IM assessment. And we will be providing much more training.
After next week's training, probably.
Lori's suggesting that after you have training next week, that you can begin.
OPWDD insists on life plan drafts when requesting waiver services. What do we do?
So I can answer that.
Thank you, Danielle.
When requesting waiver services, all right, I thought I could answer that. I was thinking about, because some of that, we're encountering some inconsistent practices, I would say, between the DDROs and the intake level, when people are pursuing waiver and needing to get Medicaid, and some of the DDROs are asking for life plans prior to issuing a letter of introduction. Do you know who asked that question?
Yes, but I have to find it now.
Yeah, we can get you that, but to Danielle's point, there is consistent practices that we're going to try to talk to OPWDD on a consistent way.
I have an outreach out to them in terms of, just, and I'm sure it's a challenge on their end as well. I mean, they've undergone a lot of transition and change, but I'm trying to work with them so that we have consistency across the DVROs.
Yeah, there should be no expectation. You're providing a life plan prior to somebody being authorized for services. At the time you're seeking authorization, they do need to have the life plan, because that's how they're assessing whether to approve that is based upon a review of the life plan. So that is an expectation that a life plan be in hand when you're requesting authorization of new services, or probably the expansion of a service. Even probably a service amendment likely will require the life plan. So that's a challenge in the interim, since you don't have them, but you could do them as an ISP. Right now, we could do them as an ISP update.
An addendum, yeah.
As an addendum.
And they should have
Is probably the way to do that.
Okay. Just questions about I-9s, and will supervisors or directors be given the list of people that need to complete that? And the answer is yes. Supervisors will be aware of that.
Before we go to the next question, I just want to do an update for people. If you remember, last week, an issue came up where we provided guidance out to all of you that if you're being reached out to from Maximus, or an assessor that is going to be looking to do a CAS assessment with someone on your caseload, and they were looking for us to provide information, we advised last week that we're not to do that. We are not able to share personal health information until we resolve access to that information with the state. And we do not have resolution on that yet as of today. So our directive still stays the same, that we are not to share information about individuals on our caseload with the Maximus folks or CAS assessors. And as soon as we have further direction on that, we will send an email out to everybody, make supervisors aware, et cetera.
Okay. The question is about the assessments that were completed, I guess IM assessments that were in process prior to the glitch with Metasced. Will they be able to retrieve them?
Maybe.
Maybe.
I think you should try. We should work to try to do that. We were told by Jan Abelseth that the ability to do that is functional now. So I think we need to go back in and just test it and see. Laura, you have anything to add to that?
You may have to close in and out of the IM app for it to update to the newest version first. It should be version 203.35 now, and that should allow for it.
Question about spell check and saving in Metasced to have it in different places.
If you're not a very good speller, spell it out on a Word document, spell check it, and cut and paste.
Right. I mean, it really should be embedded, and it has been one of the criticisms of Metasced, but it's not there yet, and we don't see it as a priority on the horizon, given all the priorities that Metasced has right now in making the platform functional. Encryption seems to be very difficult for providers, families, and individuals. We
put out instructions on.
Yeah, we put out instructions. If you have something, like today we got something about OPWDD pushing back and saying, no, we can't open this. So send that directly, like you guys are great with your screenshots, sending that right to IT and kind of raising to their attention the difficulties that you're having, and hopefully they can help you, support you in working through those difficulties, because we do not have an option. We have to protect that information.
I think the issue there, Ann, is the fact that the person receiving the email has to go in and register in order to open the email. And I don't know that they understand that they have to register in Mimecast in order to open the email. It's not just going to open up. So I think, again, that's all in the Litmos instructions as to not just for what you need to do, but the end user. So you need to be looking at that and making sure the people you're sending these emails to understand what they need to do on their end in order to open it.
Okay, there's a question about how long will we be carrying Tier 4 individuals on our caseload, please? We don't have an answer to that. Again, we are trying to work with the state, and then we will be working with folks here in terms of our caseload management approach. So hopefully we will have more information to share with everybody in the very near future.
Yeah, I mean, we've told the state we need more time to even get to the point of adjusting the caseloads appropriately for Tier 4. They are taking that under consideration. It's under advisement at this point. They haven't said no, and nor have they approved it, but they understand that this is a challenge for all of the CCOs.
Lisa, will you repeat the email to send resumes to for care manager positions?
Oh, sure. They're going to send it to Suzanne Brown, and her email is S as in Sam, Brown 1 at caredesignny.org.
And one is the number one.
The number one.
We also have a link on our website under careers. Right now it has Stephen Morgenstern's email, but we can update to Suzanne. But you could refer people to our website on the careers website, and even if they're using Stephen for now, it'll get to the right person.
Right.
Can we do that?
Okay, so there's a question for Dr. Byron. The physician's signature on level of cares is typically completed by our regional DDSO. Would they still be forwarded to them for completion, or do we not have the option of forwarding to you?
So I'm the backup.
Yes.
So when you have difficulty and you've called somewhere 5 times and they're not responding, then don't waste any more time and get them to me. Now, the local people around here are going to come to me directly, but anybody who's off-site from here, I'm your backup. If you need a doctor to sign, I'm available to do that. You scan it to me, within an hour or two, I'll sign it and scan it back to you.
Have we identified, Megan, do we know where has the state told us in which areas that their docs sign versus not sign? Have we?
Yeah, I don't think that they've actually told us, but I think just in terms of practice, generally, I know that Region 4, which is New York City, has a doctor there.
Right.
Region 1 may, but I think it's something, Jim, to your point, that we could try to get.
Yeah, we need to firm
an
this up with the
assessment of.
state. So they need to tell us specifically, which regions the expectation is their doctor is signing off, and Dr. Byron is the backup for that, and then every place else or whatever it is, so that we know which one, so the staff know what they need to do. So we should get that from OPWDD.
Yeah. Lori, I have a question for you, just because you're the Metasced queen. If someone's trying to do an IM assessment and their hotspot won't connect and they have no Wi-Fi access at the place that they're doing it, is there any offline option for the IM assessment? Not at this time, right?
Not at this time.
Okay, so I guess that what would happen if you can't do it at that site, you would need to complete that IM assessment somewhere else. Okay. For mileage checks, what if you have direct deposit into multiple bank accounts? Where does the mileage check deposit go?
Charlie?
I don't know if
Charlie, you
Charlie's
there? I don't know the answer to that, because I think it's going to depend on which bank account accounting used or finance used
Yeah.
to pull
For the
into
payroll.
Great question. So we'll have to get something out there for people.
them all.
All right, a couple more questions. We're running out of time, we know. We're gonna see if we can answer anything else. Yep, a lot of mileage questions, a lot of that's the same question coming up and up and up and up and up and up. All right, anything else? Anything else anyone has while I'm just going through fill in the dead space while I'm looking to see if there are any other questions that we need to answer? Not with music, with content. All right.
Oh, I know, Ann.
Thank you, Lisa.
I'm sorry, I wanted to talk just very briefly about the fact that, as you all have probably noticed, your email addresses look a little different, right? The way they're appearing in Outlook, it's all in capitals, and it's your official name, and that's been problematic for people who go by an alternate name. And so we're working very closely with IT. You know, that information came from Paycom, and it overrode what was already existing in Outlook with information that came directly from the official payroll system. So that's why it's showing as your official payroll name. We're working with IT right now to develop a questionnaire to go out and ask you what is the name that you'd like to go by. We do have a field for that in Paycom, and we're going to try to use that field so that we can populate the Outlook database, the way Outlook appears for email, with what you want it to appear as. Generally speaking, I will say we're talking about first names here. We're not talking about last names. We're talking about, you know, if your name is Pamela, but you go by Pam and you wanted to say Pam, then that is what you would put on this survey. So be on the lookout for that. It should be coming out in the next few days. And I don't want people to get nervous about the fact that their email looks all funky right now. Apologize for that, but we're working on it.
Someone had a question about IDs and when you're getting it. We have launched our first test site in terms of getting IDs, so we'll be rolling them out very quickly if everything works well, and we think that it will. So we have started the process of IDs, and they will be rolling out soon. I think the rest of the question, and that will go for business cards too. I'm just waiting for the web developer to give me the final verdict, the final form, and I will launch that out so that you can start putting in your information for business cards. Everything's been provided to them that they need at this point. So we have lots and lots of other questions, but many of them are duplicates. We will work on dividing and conquering those questions and then getting those answers out to all of you. So thank you very much. Have a great rest of your week, and we'll talk to you soon.